The muscles, bones, and joints cause a ton of output of cost in the healthcare industry. How do we know this? When we look at lower back pain, it's one of the most expensive conditions. When we look at joint issues, how many people do you know that have had a joint replacement? How many people do you know that have arthritis? How many people do you know that live with chronic headaches or chronic low back pain? There's all sorts of this going on. And today we're gonna talk about one of the things that's just kind of overlooked in all of this. I'm Dr. Jeff Cumro, and over the past 15 years, I've been blessed to work with over 5,000 patients. And through that, I've looked at a lot of things that I was like, okay, this is working for this person. I see this over here, and this person seems to be on a good path, but yet they're still having the problems. What is holding them back? And when we look at things, we have to look at things from a more robust framework, right? And the reason that we have to do that is a lot of times people will have symptoms that don't, they'll show up in one area, but they're not the actual cause of it, right? My knee hurts, but my hip may be causing that. My back hurts, but my knees may be causing that. My back hurts, but my hips may be causing that. There's a bunch of different things that can lead into these other areas because the old song, the knee bone is connected to the leg bone's connected to the hip bone's connected to the backbone. All these things go together. They are very, very closely related. They come into contact with each other. Those muscles cross multiple joints in some occasions. That leads to difficulty in localizing where the problem is. And the number one problem that I see, and everybody knows strengthen your core is something that they should focus on, right? We've been preached and preached and preached on that stuff, and it actually is very, very important. However, it's not the only thing that we need to see. So we're going to do a little terrible drawing today, and ultimately, hopefully, you guys can get the gist of it from my limited art skills. So when we build a house, we want to make sure that we have a nice, strong foundation on that house, right? So this is why we build a basement under it, or you build your block frame or whatever it is. You want a nice, strong framework down here. Why? If we don't have this strong foundation, something's going to happen and this is going to collapse, right? If this is sand that we build this on, one side can drop down, and then as soon as you have this skewed direction, it puts all these forces going this way on that, and everything falls apart. It drops down, it breaks down faster than what it should. And yet this is what happens on our bodies in many cases, right? And I'm going to give you one example of this. We're going to talk about a knee pain right now, okay? So what I see, a lot of people are struggling with knee pain, and a lot of it is coming from the hips or lower back. And if they fix their hips or lower back, it takes pressure off of this. But it's not just the hips or lower back. We see the shoulders have the same issues. We can see the elbows have the same issue. There's a lot of times people have pain in the elbow or arm. It's coming from the neck. It's because we don't have that strong foundation that we need. And when we get all of these things balanced out, and it's not just strength. Yes, developing strength is important for that, but we also need to have strength through a range of motion. And let's just talk about that first, okay? So when we see, an earthquake hit or whatever, imagine this is a skyscraper. You see those skyscrapers, and they're going 30, 40 feet this way, and then 30 and 40 feet this way, but they don't collapse. Why? They're built to have that flexibility and that stability through a range of motion. And that's exactly how our bodies are built as well. We are built to have that stability through a range of motion. Certain muscles are supposed to fire, other ones are supposed to relax, allow you to move through that range of motion that you're trying to move through, and yet still be stable. But let's go back to our person here. We're sticking with stick figures because that's about the limit of my capabilities here. And I'm going to make this just a little bit exaggerated so we can actually see what's going on here. So we're going to say this is upper body and this is the feet here. He's standing up. There's going to be a slight knee bend. So this is exaggerated for our demonstration purposes, right? So what happens in a lot of cases is we get some weakness. We get a little bit of sitting tightens these muscles up. It weakens these muscles back here. And what this does is it tilts the pelvis, which brings our force this way. So we start leaning forward a little bit more. So if you ever see a toe walker, a lot of times this is the case. As we start to bring our weight forward, the weight distribution on the foot starts to come forward. How do we stay upright in this? We start to get forces that counteract pushing back in here. And so we get different usage of this knee joint. And so up in here, the stability, the flexibility, and the ability to move through range of motion with stability all come into this joint down here. So it's one of the most important things. If we are just focused on the knee, you might miss a lot of other things, because this is going to set you up for weakness, back pain. It could set you up for arthritis. It could set you up for, some sort of injury where you fall and you've already got everything arched like this. So you end up with different forces here that lead to compression fractures or whatnot. So there are a lot of different possibilities that this leads to. There's different possibilities that this, can present as, because it's not necessarily one injury. One area being weak can present in multiple different ways. So foot pain would be another one that would be a possibility, because as you start carrying that weight more forward on your feet, it's going to flatten out your arches. It's going to lead to more foot pain, right? So this is the thing that I want to shift in your mind, right? We don't just need stability. Yes, you need to go and strengthen your core. I can say that with 100% certainty, because we all could use more stability in our core, right? Even the person that is the strongest core on the planet probably can still improve the strength in that area more, and it's going to provide them more protection. So pretty much without fail, there are exceptions to this, I am sure, but pretty much without fail, you're probably not one of them. The likelihood is low, right? The greater percentage of us are going to fall into this category where we can build strength here and be better off. But we also need to work through a range of motion. So building strength tends to shorten a muscle, right? So if you flex your bicep, you got your arm here like so. You shorten this muscle. When we strengthen, we shorten. So we also have to go through and lengthen these muscles, right? That's where stretching comes in. This is where yoga, this is where any kind of stretching, this is where mobility work, different things like that are going to be important. And having that combination of both flexibility, stability, and the ability to stabilize through a range of motion is what brings us back to this over here. We're able to withstand those forces that take us into these different directions when we're not planning on them. Because when you lift a fridge, a lot of times people are going to be able to stabilize. They know what they're doing. They get in a solid position. They get down and they lift. It's more frequent for me to see people who like go to pick up a pencil or, just bend forward to put on their socks, different things like that, and they get hurt. Why? Because they're not thinking about it. It's something that's simple. So they don't take the time to stabilize and move through the range of motion that they need to. They're not able to withstand these everyday forces that are being put on the body. So that's the thing I want you to think about. If you have questions on this, by all means, reach out. But this is one of the things why chiropractic is so important. It's not just understanding the area that is hurt. And in the healthcare industry, we've gotten so focused on, hey, you know what? Your knee hurts. You need to go to a knee doctor. And your little toe hurts, so you need to go to a little toe doctor. And we've narrowed it down to the point where it's so focused on that one thing, but so often we have other things that are leading into this. And that's not just for the musculature and bones and joints. It's also for the organs, right? So I see a lot of advice. They're like, hey, you know what? Why don't you have a couple of drinks because it would help your heart? Yeah, but it's terrible for your brain, okay? You're moving toward dementia. That's probably not a good fit for you. You have brain fog. That's probably not a good fit for you. You have sleeping difficulties. It's probably not a good fit for you. So while that might be good advice for that one area of health, it's not great advice for the global thing. And that's the big shift we need to get away from. We need to figure out the holistic care, the ability to look at the body as a whole, the person as a whole, and figure out what is best for them to get their problems solved. So, as always, I love you guys. I appreciate you tuning in. I know your attention and your time are your most important, our most valuable resources anyway. And I appreciate you spending some of that with me. So I will catch you on next week's video. In the meantime, you have yourself a phenomenal week.